Hey, I'm Dr. Alex McRee here in Jacksonville, Florida at JAX Implants and Dentures. Here today with another episode of things you need to know about dental implants. Today's topic, healing from all-on-4 dental implants. Also known by full mouth implants or teeth express or teeth in a day. Basically, where you're doing a whole set of teeth. Whether that means you're taking out all your teeth at the same time, or if you're a dentalist, which means you don't have any teeth, you're putting in implants to replace what you used to have. Really gonna go on today about things you should be looking for or asking about, and kind of going over things we do here to help with the healing. Obviously, you're gonna be sore, things are gonna be a little stiff the next day. And I will say one small caveat, I do come from experience. I do not have all-on-4 dental implants, but I've had my top jaw broken and reset, so I do have titanium plates all the way across the top, so I do know what this feels like, and I do know what you will be experiencing. So, where do we get started? So, you've had your all-on-4 dental implants, or you're getting prepared to have your all-on-4 dental implants, and things you need to know. Again, during it, you should be numb. We do different types of sedation, but that's not really the point of this video. This is more for the recovery. The first thing we do, ice. I know that's the most basic thing, right? Everyone talks about it, but it's super important. It's something we do here. You get ice on immediately, right? So everything you can do to prevent the swelling is that much less swelling you've got to flush out later. And some people want to do ice up for like the first 7-10 days and keep doing ice. Really, that's not what you want to do. You want to do ice at the beginning, right? That's to help it clot, to help it stop bleeding, to help it stop swelling. So that way, later on, you don't have to flush out as much. But what do you want to do? You want to flush it out later. So about day 3, day 4, once you're kind of good, you maybe a warm compress or even a heating pad or something like that. And that's just to promote blood flow. Just like if you were to put a hot area there, you see your skin get red. What that means is blood flow is getting there. That's what's causing that redness. But what that's doing is providing nutrients from your blood to be able to go in there and flush out some of that swelling. The second thing we do here is actually something we do during surgery. We do it with every single surgery that we do. It's called PRF, Platelet-Rich Fibrin. You may have heard of a vampire facial or a PRP injection or something like that, to like help with arthritis or inflammation. It's kind of the same thing as PRP. So what we do is we actually take a blood draw from you before the surgery. So we use your own healing factors. So it spins it down, it comes into 3 layers is what your blood essentially breaks up into. And so there's a real rich area right in the middle that has all your platelets, which you've probably heard, or like that's why like you heal very well. Fibrin is the things that like make scabs and helps your body clot and heal essentially and close things up. So basically we can take that fibrin, which is enriched with all your platelets, and lay that over the surgical site. What does that do? Well, it promotes healing. And so that's what we're trying to do, right? We're promoting your recovery. So it stays in the body about 5 to 7 days. Well, that's the most important time of recovery. So that helps prevent swelling, helps stop the bleeding, and then also promotes the healing. So it works beautifully. We do it with every single case. If you're not getting that done where you're at, I would highly suggest it or at least inquire about it. The third thing that we do is huge here. We do what's called Exparel. And what that is a long-lasting numbing agent. It doesn't keep you completely numb, right? We don't want your face going all the way down. You can't eat and then stuff's falling out of your mouth as you're trying to eat. But what it does is keeps you like 50 to 70% numb for the first 48, some say 72 hours. But it's kind of like, I don't know, maybe boba tea, something like that, which I don't know if you've ever seen that out there, and it's basically like little bubbles in tea, right? And they kind of pop and release every once in a while. So what we do is inject it there like normal anesthetic, and over time that slowly releases, right? So it's not the full anesthetic like where you go in and actually numb up for like a filling or a crown or extraction or like we did for the surgery. It's the same thing, but then it's just very slow release. Kind of like extended release, tablets that you might take orally that, just dissolve over time. It's the same thing, but in anesthetic form. And so that's what helps us go for the first 48 hours with not having near as much pain, which helps, again, the recovery. The fourth thing that we're starting to do here is obviously your typical pain management. So you can do your ibuprofen, Tylenol, even some opiates, right? So like, Lortab, Norco, maybe even Percocet or oxycodone. But those can come with some downsides, right? I mean, everyone knows the opiate epidemic. That's not something we want to contribute to. But we've been using what's called Journavx. It's a FDA-cleared pain reliever. It's not something we invented, right? Actually made by, a medical company or pharmaceutical company, rather. And we've had amazing success with it. We've been using it for about the past year. And so it's a non-opioid pain reliever. I think it's the first one that was released within the last like 25 years or something like that. So we've had really good success with that. So basically, if you are getting all-on-4 dental implants, you want to know if all these multifactorial things are being done, right? You want ice immediately, you want pressure on there, right? You want Exparel, right? You want PRF on the surgical site. You want potential alternative pain relievers because, you know, we're not able to mask everything. So it's a culmination of these things is what you should be looking for when you're looking to lessen the recovery for your all-on-4 dental implants.